immigrant. As promised, today I'm going to tell you about Canadian healthcare. Taking into consideration Canadian medical care, I wonder how Canadian children survive. Russian-speaking people are seriously terrified of Canadian medical care. They believe that family doctors are very relaxed. Sometimes they look inexperienced. They don't rush to send people to medical exams, and they are very optimistic. They always try to convince you that you're absolutely healthy. However, in Canada, the average life expectancy is 80 years for males and 84 years for females in 2019. Whereas in Ukraine, the average life expectancy is 66 years for males in 2019. Just think, 66 years in Ukraine and 80 years in Canada. However, Russian-speaking people miss doctors and medicine from their native countries. What's wrong with the Canadian healthcare? To understand this issue, it's necessary to see how everything is organized, how healthcare is organized in Canada. No matter where you're a citizen or a permanent resident, you have a health card with health card number. And it means that when you come to a healthcare provider, you always provide this number. And it means that all services, checkups, medical examinations, X-ray, ultrasound, MRI, giving birth to a baby, staying in the hospital, everything is free for you because it is covered by provincial public health. What is not covered? Dental care, vision care and chiropractic. But they are covered by the insurance. As soon as you work full-time, your employer provides health insurance for all family members in your family. So either you don't pay anything at all or you pay just 20%. For instance, in our family, only my husband works, but all family members are covered. Vision care is covered by insurance for adults, but it is covered by provincial public health for children. And children's vision is examined every year as soon as they go to the kindergarten. And as soon as your child's vision is examined, they schedule another appointment for the next year. You can buy a pain or fever relief medication in the supermarket or a drugstore without seeing a doctor. But as soon as you need a stronger medication or antibiotic, it is prescribed by the doctor. So at drugstore, you provide your health card number and you buy this prescribed medication, and it is covered by the insurance. There are many chiropractic and dental centers around the city, so you can choose any you like. But you can't choose a family doctor. In clinic, there are many family doctors, and they give you a family doctor, or they don't give you. As soon as you come to Canada, maybe they don't have enough family doctors, so they give you any doctor who can make checkup for you. I know one case when people could choose a doctor, but I think it is not a common thing. I think that somebody recommended this doctor to them. This person gave contact information. They phoned to this doctor, asked this doctor, and this doctor agreed to be their family doctor. But usually you can't contact any doctor. You can just come to the doctor because everything is made by front desk. So you need to schedule an appointment. For instance, in Ukraine, the clinic where you go and the doctor depends on your address, and there is the front desk, and theoretically you should report to the front desk first. But in real life, you can go to any clinic you like, to any doctor you like, and you don't need to go to the front desk. So doctors are usually in their offices, and people wait in line near each office. So you just can come to any doctor. Maybe somebody recommended this doctor to you, or maybe somebody recommended this clinic to you, and you don't know the doctor. You just come to his or her office, and if you like him or her, you ask to be treated. And in this case, you pay some money to his or her pocket. In Canada, the situation is different. Everybody is waiting in one waiting room. Doctors are not in their offices. As soon as you have an appointment, the nurse takes you to the doctor's office, and you wait for the doctor there, and then the doctor comes. And there are two front desks. One is walk-in desk. It is for urgent cases. For example, you have a cold or you have a pain, and you come, you stay in line, and in this case you can see any doctor who is not busy. And another desk is for appointments, and you can't schedule an appointment with any doctor you like. If you have a family doctor, you can schedule appointment only with your family doctor. If you don't have such doctor, they give you any doctor who makes checkup for you. So in Canada, you don't have the right of choice. If you schedule an appointment, it can take from 1 week to several months to see the doctor. One more difference is nurse's desk. In Ukraine, almost all doctors have nurses, and in the office there is a doctor and his or her nurse. In Canada, all nurses in one room. This is a nurse's desk, and nurses deal with some medical exams, immunization, and some other tasks. By the way, if you want to get a flu shot, you can go to the drugstore. You provide your health card number, and it is covered by provincial public health. You don't pay anything for the flu shot. If your child is under 7 years old, he or she can get a flu shot only in clinic. So in this case, it is necessary to go to nurse's desk. Specialists are either in the other department or in the hospital. For instance, in our city, clinic is small and there are only family doctors are there. So, and specialists are in the hospital. In Ukraine, there are many labs, ultrasound offices, MRI offices, and many of them are private. So you can choose any you like, and you don't have to go to see a doctor before having a medical exam. You just can come to the lab and have medical exams personally for you. You don't need to see a doctor. In Canada, you can't have medical exams or ultrasound examination or MRI without seeing a doctor. Your results are not given to you. They are put on your file and only your doctor can see them. And if everything is fine, nobody calls you. If there is a problem, a nurse can contact you and report this problem to you. Of course, you can see results, but you should go to the nurse's desk. But as I understand, it is not a common thing in Canada. So, what don't Russian-speaking people like about Canadian healthcare? I'll give you several examples. First, how flu and cold is treated in Ukraine and in Canada. In Ukraine, there are two kinds of doctors. Some doctors are very pessimistic. As soon as you come with cold or flu to them, they try to terrify you, and when you leave their office, you understand that everything is awful. And other doctors are very indifferent. They are not interested in your problem at all, and they just never mind. But in both cases, doctors write the list of medications, and one of these medications is an antibiotic. In Canada, all doctors are very happy to see you, and they listen to you closely. They are very sorry even if you come with flu or cold to them. They tell you how happy they are to see you, how it is wonderful to see you, and at the end they wish you a nice day, but they don't prescribe anything because it is just cold or flu. So what you need just to drink a lot of fluid and go to the supermarket or drugstore and buy fever or pain relief medication. That's it. Number 2. When your child has a stomachache, in Ukraine they send your child to different medical exams, and they can even send to ultrasound examination. And then they write the list of medications, and one of these medications can also be an antibiotic. In Canada, they don't see a problem at all. If your child doesn't want to eat, let him or her drink. So no medications, just give a lot of fluid, and that's it. And example number 3, if your child has a scarlet fever or a chicken pox. In Ukraine, it's a very serious problem. Your child doesn't go out. He or she sits at home. Nobody can visit you. And of course, you use green ointment for the red spots. And in Canada, it is not a problem at all. It just ends by itself. So it's not a problem. There are no medications. There are no ointments. So as you see, what is a problem in Ukraine? It is not a problem at all in Canada. So what are disadvantages and advantages of Canadian healthcare? First, let's discuss disadvantages. Disadvantage number 1. The ambulance is very expensive. For instance, in Ukraine, you can call an ambulance anytime, and it is legal, it is free, but as soon as a doctor comes to you, you usually pay some money to his or her pocket. In Canada, calling the ambulance is very expensive. That is why people prefer to go to emergency department by themselves. Disadvantage number 2. It takes too long to wait in the emergency department. As soon as you come to the walk-in desk, you wait in line, and the earlier you come, the earlier you'll see a doctor. If you go to the emergency department in the hospital, you don't know how much time you will spend there. Because first you see a nurse, and she decides how urgent your case is. If your case is not urgent, too urgent, and there are patients who need help sooner, so they will be treated sooner, and you will wait for hours. And I know cases when people wait for up to 8 hours in the emergency department. In Canada, you are not responsible for your health for 100%. You depend on your doctor, and you depend on your clinic. For instance, in Ukraine, you can choose a lab, you can choose a clinic, you can choose a doctor. You can even see several doctors and just to check how they are ready to treat your health problem, and you just choose which doctor you like the most. In Canada, everything depends on your clinic. So, and you depend on your doctor. You can't just to have medical exams just because you want. And for example, ultrasound or examination or X-ray, they are covered by provincial public health. So even if you think that there is a problem but your doctor doesn't think so, he or she will never send you to this examination. So only the family doctor decides if you need ultrasound, X-ray examination, or any other examination. In Canada, you don't have the right of choice, and I know cases when doctors' mistakes hurt people's health, and I know even cases when people prefer to go to their native countries to be treated there. And what I really like about Canadian medical care. Advantage number 1. I don't need to pay for medical care in Canada. I don't need to buy gloves or something else for medical exams as I used to do in Ukraine. I don't have to bribe doctors and nurses to be treated well as I used to do in Ukraine. Everybody treats me as a client. All nurses and doctors are very friendly, and they even ask to complete the survey just because they're interested in my opinion, if I'm satisfied with how I was treated. And I don't need to pay for staying in the hospital, and I don't have to buy medication when I stay in the hospital as I used to do in Ukraine. Advantage number 2. All my information is on my file. As soon as I provide my health card number, all doctors see my health history. I don't need to retell my health issues again and again, as I used to do in Ukraine when I decided to change a doctor at some point. Advantage number 3. If I want to have an annual checkup, I schedule an appointment. And yeah, it can take several weeks, but when I come to clinic, I don't need to wait for hours as it used to be in Ukraine. So I like this idea with appointments. And advantage number 4, I like the idea with flu shots. It's wonderful that I can get a flu shot and I don't need to pay for it at all. So I can go just to any drugstore and be vaccinated. In general, vaccination for children and adults is covered by provincial public health. Advantage number 5, Canadian doctors never prescribe antibiotics without medical exams. They prescribe antibiotics only in case if exams show that you're infected. And in Ukraine, doctors prescribe antibiotics as soon as you come to them. Advantage number 6. There is a wonderful equipment in any doctor's office. I didn't see such equipment in Ukraine. I'll give you example about vision care. When you examine your eyes in Ukraine, you just close one eye and read letters on the wall, and then you close another eye. Here they use many techniques. In Canada they use a lot of equipment, so they try to examine you from all angles. So I didn't see such equipment and such examination in Ukraine. So as you see, there are 3 disadvantages and 6 advantages. Am I satisfied with Canadian healthcare? Yes I am. Until all members of my family are healthy and we don't need serious treatment, I really like Canadian healthcare. But what if something happens and we will need this treatment, but we can't even choose a lab or a doctor or a clinic? In this case, I think it's a good idea to be optimistic, and it's a good idea to take an example from Canadian doctors and believe that everything will be wonderful. In your comments, write if you are satisfied with your healthcare in your country, and if you live in Canada or in the USA, write if you are satisfied with your healthcare. And you can express your opinion in Russian, English or Ukrainian. Have a nice day. Bye bye.